Hello, I am Meghna Jaina, clinical nutritionist in BLK Super Speciality Hospital. Today we are going to talk about diabetes mellitus, as it is most common in human beings, though it occurs in other species also. Diabetes mellitus is of two kinds. The first is maturity onset diabetes, also known as non-insulin dependent diabetes. It generally occurs after the age of 40. Second type of diabetes is juvenile onset diabetes, which is also known as insulin dependent diabetes. Symptoms of diabetes generally seen are excess urination, excessive thirst, inadequate appetite, and weight loss. Diabetes can be controlled by three ways: diet and exercise, diet and oral drugs, diet and insulin. Therefore, diet plays an important role in maintaining your blood glucose levels. For people with diabetes, staying healthy and eating healthy is a long-term health goal. Staying healthy is not only about maintaining your blood glucose levels, it's about your metabolic control. What is metabolic control? It is about controlling your glucose levels, your blood lipids, and your blood pressure. The nutritional therapy for a person with diabetes is to control his weight also. Although 80% of people with diabetes are seen overweight and they are pre-diabetic also. In all type of diabetic patients, the amount and type of food intake, particularly carbohydrates, should be controlled to prevent the fluctuations in the blood glucose beyond the normal levels. Intake of refined sugars should be restricted, as the consumption is followed by absorption and high peak of glucose levels. Diabetic people should not be fasting or feasting. There are two essential points when we prepare a diabetic diet. Firstly, the energy intake should be adjusted to maintain the ideal body weight, especially in obese and maturity onset patients. Secondly, all the patients taking insulin should follow a regular meal pattern so that it can be matched to the insulin injected. Alcohol should be avoided or least consumed, as it results in hypoglycemia, which can cause damage to nerve and heart. Then all the diabetic patients should be taking foods which have a low glycemic index value. Greasy and rich spicy foods should be avoided, as they are not only difficult to digest but can cause severe stomach irritation, especially in old diabetic patients. The quality and quantity of food should be adjusted according to individuals' sugar levels. To know more about diabetes and diet, please subscribe our YouTube channel, in which we will be discussing about the diet. Thanks.
BLK Super Speciality Hospital, a passion for healing.